So hi everyone, I am Mary and I come from the University of St. Andrews in Scotland. And I'm going actually today to present one of my PhD thesis chapters, which I just finished my PhD in November and graduated. So my presentation is entitled Is Air Pollution Associated with Poor Mental Well-Being and How This Association Differs by Ethnic Subgroups in the UK? And during my PhD, I was supervised by three professors. So I had Urshka Demsar, Frank Sullivan, and Hil Kulu. So just to give a brief introduction, so air pollution, which includes several air pollutants, and the most studied air pollutants include nitrogen dioxide, which is abbreviated as NO2, sulfur dioxide, which is abbreviated as SO2, and particulate matter, which are small diameter pollutants. And those include PM10, which is particulate matter with a diameter of less than 10 micrometer, and PM2.5, which is particulate matter with a diameter of less than 2.5 micrometer. And increased exposure to those pollutants have been shown by the literature to affect health and lead to poor health and high rates of hospital admissions and mortality. And also these pollutants, they come like from various sources. But for example, for nitrogen dioxide or NO2 and PM10 and PM2.5, they mainly come from traffic exhaust. SO2 mainly comes from industrial pollution. So in recent literature, there has been showing a relationship between environmental factors such as exposure to air pollution and like poorer mental well-being. And how can air pollution then affect mental well-being? This could be either directly or indirectly. So directly involves the biological mechanisms by which air pollution affects mental well-being. And these include, for example, when the gaseous pollutants such as NO2 or SO2, or even the particulate pollutants such as PM10 and PM2.5, they enter our respiratory system through inhalation, and then they can infiltrate deeply into the lungs and then into the bloodstream, and then they reach the blood-brain barrier. They can cross it, and this can cause neurological damage and lead to in turn to poor mental well-being. Now, indirectly, air pollution can also affect the mental well-being through nuisance. So, for example, if people live in areas which are highly polluted, especially if the air pollution has has visible signs. For example, you can see like the atmosphere is polluted or like has some odorous nuisance. So this might create nuisance for people living in those areas. And then those people, like they might either experience worrying feelings about their physical health because they are living in pollutant areas. And this in turn will affect their mental well-being. Or also like those individuals might not go outside so much, so prevent going outside and doing, for example, physical exercise outside or going outside, which might improve their mental well-being. And this in turn affects their mental well-being in a negative way. Sorry, my slides are not changing. Okay. So despite the establishment of linkages between air pollution and poor mental well-being in the literature, this stream of literature is like still new, and results are generally until now inconclusive and they require further research. So in this study, we tried to investigate the effect of air pollution on mental well-being in the UK using a spatial temporal between within longitudinal design. And we also aim to assess if this effect differs by ethnic subgroups in the UK. So methods, I will not go in details into explaining the data set that I've used because it's similar to Karen, so you already know about it, but I'll just give a brief overview about the data set. So for this study, I used the individual level data from the UK Household Longitudinal Study, which is abbreviated as UKHLS. And I had a total of 60,146 adult individuals of age 16 plus who contributed 349,748 repeated responses across the 10 data collection waves in the UKHLS data, which spans over 11 years from 2009 to 2019. And then I linked this individual level data to annual air pollution data using the census lower super output areas, abbreviated as LSOAs, of residents for each individual in each year. And then for mental well-being, this was measured using in the UKHLS data using the General Health Questionnaire, GHQ 12 scale. And as Karen explained in her presentation, this scale is composed of 12 questions, and each question is assessed on a 4-point Likert scale. And then the scale is summed up, which results in a general score between 0 and 36. And based on the literature, I used the cutoff point of 12, whereby scores greater than or equal to 12 indicate poor mental well-being. Also, there is another way of using this scale, and this way would be by first dichotomizing each answer to each of the 12 questions and then summing them up. And this results in a total score between 0 and 12. And here also I refer to the literature and I use two cutoff points. The first cutoff point is my sample mean, which was 2. So everything scores greater than or equal to 2 indicates poor mental well-being. And then also based on the literature, a cutoff value of 4 also indicates poor mental well-being. So I tried to use 3 outcomes here with the 3 categorizations of this GHQ-12 scale to assess the mental well-being. Now, I tried to use something called spatial temporal design in my analysis. And to assess this spatial temporal effect of air pollution on the mental well-being, I decompose what I call as the air pollution effect or the overall air pollution effect, which is linked at the LSOA's level on mental well-being, into between, which is spatial, and within, which are temporal effects. So the between or spatial effects are used to determine the spatial effect of air pollution by computing the mean of air pollution across the 11 years of follow-up for each LSOA area, whereas the within effects are used to determine the temporal effect of air pollution by calculating the yearly air pollution deviation from that 11 years mean within each LSOA area. And then I used multi-level mixed effect logistic models for analysis. So now I will jump to the results. So first of all, I'll just provide some descriptive results. So description of individuals' reported mental well-being. The mean score for the mental well-being GHQ 12, which is assessed between 0 and 12 scale, was 1.8 with a standard deviation of 0.2. And 30% of the responses, they had a GHQ 12 score of 2 or more, while 19% of the responses showed a GHQ 12 score of 4 or more. Now, the mean score for the GHQ 12 questionnaire, which is categorized as 0 to 36 scale, was 11.14, and 36% of the responses had this score of 12 or more, which indicates poor mental well-being. Okay, so now we go to the description of the individual's socio-demographic and lifestyle factors in the UKHLS data. And here I only include the first and last waves of the UKHLS data. Okay, so we can see that the majority of individuals, more than 50%, were females. And the majority were in the middle age category between 34 and 58. They belonged to the British white ethnicity. They were born in UK. They were married. They had a high school degree for education. And then for occupation, they were non-manual workers. And for perceived financial situation, the majority said they were living comfortably slash doing or this percentage increased significantly in the last wave, in wave 10 compared to wave 1 of the UK HLS dataset. And then finally, for smoking cigarettes, the majority, they were non-smokers in both wave 1 and wave 10 of the data. So now description of the 4 air pollutants used in this study. So on average, here, like I'm showing the average of the air pollutants across all the LSOA areas in the UK for each year between 2009 and 2019. So here we can see a bit of positive story. So you can notice that the air pollution levels, they decreased in general from between 2009 and 2019. So if we look, for example, at the nitrogen dioxide here, which is the green, and then at the PM10 or particulate matter with diameters of less than 10 micrometer, which is here the blue, we can see the concentrations of both pollutants decreased from 17 and 15 micrometer in 2009 to 13 micrometer to 13 microgram per meter cube in 2019. And then if we look at the yellow color, which corresponds for the PM 2.5 pollutant, this also reduced a bit from 10.5 microgram per meter cube in 2009 to 8.5 microgram per meter cube in 2019. Also, like the same for sulfur dioxide, it reduced a bit, which is the dark green in the bottom. But usually sulfur dioxide concentration is much lower than the other pollutants because it's highly toxic gas. And here I'm showing a correlation matrix between the pollutants. And we can see that we have high correlation between nitrogen dioxide or NO2 and PM10 and PM2.5 pollutants, whereas this correlation is not as high between sulfur dioxide or SO2 and the other pollutants. And the reason for that is the different sources of the pollutant emissions. So for SO2, it mainly comes from industries, whereas the other 3 pollutants, they mainly come from traffic exhaust. So now to the main results of this study, which here in this table, I'm showing the association between increased exposure to air pollution and the mental well-being. So in the first column, we have the mental well-being, which is assessed the general score scale between 0 and 36 with a cutoff point of 12. So here we can see that with increased exposure to all the 4 pollutants, this is associated with poorer self-reported mental well-being. Because here the odds ratios are greater than 1, and it's significant with 2 at the level of 0.01 for p-value. And then the same goes for the mental well-being when it's assessed between 0 and 12 as an overall scale, and taking 2 cutoff points here of greater than or equal to 2 and greater than or equal to 4. So the same story with increased exposure to all the 4 pollutants, we see that people tend to report poorer mental well-being. Now, when we go to assess the spatial versus the temporal pollution effects, we notice that we only observe significant spatial or between pollution effects. Whereas for temporal pollution effects, we don't see any significant association. And this implies that in general, if you live in more polluted LSOA areas, you are more likely to report poorer mental well-being. However, like the report of poorer mental well-being is not associated with the fluctuation of air pollution across the years from 2009 to 2019. So now we tried also to see whether this effect of air pollution on individuals' mental well-being varies by ethnicity and country of birth. So we carried a stratified analysis by ethnicity. And here we're comparing everything to the British white ethnicity. So using the GHQ-12 questionnaire, which is assessed between 0 and 36 with a cutoff point of more than 12, we don't see any differences between the ethnic groups. As you can see here, everything is crossing the one line of odds ratio, so there are no significant associations and no significant differences between the ethnic groups in the UK. And then the same story as well when we assess the mental well-being between 0 and 12 with a cutoff with two cutoff points of greater than or equal to 2 and greater than or equal to 4. We don't see like significant differences. The only exception here is for the Pakistani group, Pakistani/Bangladeshi group here. They are in general showing poorer self-reported mental well-being with higher exposure to sulfur dioxide pollutant and PM2.5 pollutant. And the same for people not born in UK compared to those born in the UK. Also, they are showing poorer reported mental well-being with higher exposure to sulfur dioxide pollutant and PM2.5 pollutant. And this is only relevant when GHQ-12 questionnaire is like assessed between 0 and 12 with cutoff values of greater than or equal to 2. So in general, like we don't see so much differences between the ethnic subgroups. So to summarize quickly the results of this study, okay, so using longitudinal, individual level, and contextual linked pollution data, our study revealed an association between higher exposure to air pollution and mental well-being. Though this association was mainly a spatial one rather than temporal one, so it was mainly attributed to residing in more polluted areas rather than the air pollution fluctuation across time within each geographical area. So environmental policies to reduce air pollution emissions can eventually improve the mental well-being of people in the UK. However, when we tried to see if there are any ethnic differences with respect to this association, we didn't see any differences. So the association between air pollution and mental well-being did not vary by ethnic groups and country of birth. Finally, I would say that further research is needed in this area, and this would help develop more the evidence on this important topic. So thank you so much for listening for my presentation today. This study is now published in PLOS ONE journal, and I included here a QR code for the full study if you're interested in reading more in details about this study. And finally, those are my contact details. If you have any questions, please feel free to send me an email. And thank you so much. Looking forward for questions.